the chemotherapy, what exactly is it?
Okay, so chemotherapy is just a name given to medicines that are used to treat cancer, generally. There are sometimes that we have some that we call targeted therapies, immunotherapies, that do not directly fall under chemotherapy per se, but generally, when people say chemotherapy, they are referring to medications used to treat cancer.
Okay, does it come with machines or is just the medication?
So when we talk about chemotherapy, they are basically medications, and they are generally systemic medications. Systemic in that you give it, either you give it through the vein, you give it as a direct injection, it goes through all of the body, and then it has effect in almost every part of the person's body, so that should there be any microscopic cancer cells that are lodging somewhere, just waiting for the opportunity to start growing, it helps to get rid of them.
Okay.
And for some people who have a huge burden or maybe a huge tumor, maybe in terms of breast cancer in the breast, the chemotherapy targets the disease at that part of the body. One in particular, I just chose this to demonstrate some of the medications. Right. This is a common medication we use in the treatment of breast cancer. Some people have given it a name, the Red Devil or Red Devil.
Okay.
So for most people who have gone through the treatment, when they see the color red, they are able to tell that, okay, this is the medication. But the real name is adramycin, which is written over there. So that's the real name of the drug. Okay. But I mean, because of the color, which is usually red, people have given it that other name. So this is given in the form of a drip.
Okay.
So for example, sometimes you go to the hospital and you are given some drip, you lie on the bed, there's an injection, it runs, and then the drip, the cannula is placed there, the drip is set up, it runs through. The same way, this is diluted in a particular volume using a particular type of drip, specific to this particular medication, and then it is given in that manner for the individual. So this is one example of a chemotherapeutic drug. So this is somebody who is undergoing chemotherapy. Okay. So the medication is set up, and this machine, all that it does is it helps to regulate the flow of the medication. So instead of just running it, because they are very specific medications and you need to run them at a particular rate. So you may say, okay, I want to run this for 1 hour or 2 hours. So this machine helps you to deliver that medication in that set time. So that's the whole purpose of this picture. This picture was just meant to tell us the differences between radiotherapy and chemotherapy.
Right.
Sometimes people confuse the two. When you say radiotherapy, chemotherapy, then they get confused. So radiotherapy, we use radiation. Most of us, when we hear radiation, all we remember is atomic bombs. But this is a radiotherapy machine. You can see it's demonstrated over there, the rays, which is representing the radiation.
Yes.
In natural fact, you don't see the radiation when you're undergoing treatment. Okay. But this is just meant for us to understand. And then whereas this is chemotherapy being given to somebody who is seated, and then it's given in the form of a drip.
Okay.
So there are two different things.
All right.
Another difference is that this medication is systemic in that once it's given through the vein, it goes through every part of the body because it goes into your blood. Wherever the blood flows, it's able to get there. Whereas this is specific. So most people, they get afraid when they hear that they are going to have radiotherapy because they think we just lock them in a room and then we radiate every part of their body.
Okay.
But no. There's a picture that I put up to demonstrate how we plan the treatment. So it's a targeted area. So for somebody who is undergoing treatment for breast cancer, for example, the radiotherapy is to only the breast or the part of the chest after the surgery has been done. That is where we target. We actually mark it out specifically, such that even after the treatment, you can see that there is a boundary marking the area that we treated.
Okay.
Yes, so that is the difference between chemotherapy and radiotherapy. So the chemotherapy, it goes through all of the body. And the side effects, to understand the side effects of chemotherapy, you need to understand how the chemotherapy works. The chemotherapy is designed to target cancer cells, okay? However, there are certain features of the cancer cells that intersect with certain features of the normal human body cells.
Okay.
So for example, cancer cells grow very fast. So the chemotherapy is designed with an ability to target fast-growing cells like the cancer cells that grow very fast. However, we have certain cells, normal cells in the human body that also grow very fast, like the hair. You cut your hair today, the next day, even if you do Sakura, you can already see that there's some hair already growing again. So it tells you that the hair grows very fast. So people tend to lose their hair when they take certain types of chemotherapy because of that intersection between their mode of growth.
Right.
So that's one of them. And then we all know about vomiting. So if you've heard about somebody who's gone through chemotherapy, they talk about feeling nauseous, they tend to vomit. Those are some of the common side effects when it comes to chemotherapy. And there are some people who have, or they feel like there are some sores in their mouth because of the chemotherapy. The cells that line our mouth, they grow very fast. So sometimes you wake up in the morning and you see that there are particles, flakes of cells falling, coming out of your mouth. It demonstrates how fast those cells grow. So because of that, they tend to be susceptible to chemotherapy and radiotherapy as well.
Right.
So the people may have some sores in their mouth as a result of that. And then commonly some people will have some tingling or numbness in the palms of their hands and under their feet. Some will have some darkening of their palms or under the soles of their feet as a result of chemotherapy. But let me quickly add that most of these side effects are temporary. Most are temporary. There are some that the people have to deal with for a longer period of time. But this is a form of assurance to the people who will have to go through this treatment. I know it's a difficult treatment.
Yes.
I know it's difficult. I know sometimes the publicity out there is so much, it's not good enough. So it scares people to want to have chemotherapy when they go through a diagnosis of cancer. But I want to at least state this word that most of those side effects are temporary. They are not like permanent.
Okay.
So, for example, nausea and vomiting doesn't continue forever. The loss of hair begins to grow once the individual is done with the treatment. The darkening of the palms, the soles of the feet, all of these skin changes begin to recover after the person is done with the chemotherapy. There are things that we can do to improve upon the outcomes. So when it comes to something like the nausea and the vomiting, there are medications that we add just before somebody takes their chemotherapy. And then after the chemotherapy, that is meant to reduce the nausea and vomiting that they experience, okay? When somebody receives chemotherapy and they notice that the side effects, for example, nausea and vomiting was more than expected, it's always important to let your doctor be aware. And then modifications can be made. Sometimes even the dose of the medication may be modified. And then when people are on chemotherapy, we advise that they try and stay well hydrated. Because if you are taking in adequate water, the medication is able to run through your system, do the work that it's supposed to do, and get excreted or get eliminated out of the body in time.
Okay.
So these are some of the things. And they're also supposed to have adequate rest, for example, because going through a treatment that runs through all of your body can get you stressed. And then if you have to, some people are coming for treatment today, they are planning to go to work the very next day. 3-5 days after your chemotherapy, at least, you can give yourself a lighter schedule so that you don't go through that stress. How much chemo you receive depends on the stage as well. So for example, somebody who is undergoing treatment for breast cancer will usually have up to about 8 cycles of chemotherapy. And most of the time, we give it once every 3 weeks. So if the person has a treatment today, like this gentleman is sitting there, they are done with this session. Their next treatment cycle, like this, will be in 3 weeks' time for most. I mean, it's not always 3 weeks, though, but most, it's like that. So, and it's going to be that for a total of 8 cycles. Then they are done with their treatment. They may require treatment later on in life if they should have a recurrence of the disease.
Right.
Exactly. And now, if the disease is very early, for example, in some very early stages, the person doesn't need chemotherapy at all. Sometimes, all some people need is just surgery. Sometimes after the surgery, we add radiotherapy to reduce the chances of a recurrence. And then they don't need to go through chemotherapy.